Unfortunately, we're not going to have a clean slate when we ring in the new year, at least when it comes to COVID. That's because we're seeing positivity rates up, more kids being sent to the hospital. And just this past week, the U.S. averaged an all-time high for COVID infections since this pandemic started. Joining us now to break it all down for us is Dr. Ruth Berggren. She's an infectious disease specialist with UT Health San Antonio. Dr. Berggren, thank you for joining us.
Thank you so much for having me on. And I want to start by wishing everybody health and peace in the new year. I think that is the most important message that I can give you. But you're right, we're seeing surges, and the positivity rate at the university is as high as we've ever seen it, with 31.5% of the people being tested coming back positive. So this is largely Omicron at this point. And people have gotten the message that Omicron is highly infectious, more infectious than Delta, but less lethal. And that is true, but Omicron is causing a huge number of people to come to the emergency room to be evaluated. Up to a third of the adults that are coming into the university hospital emergency room right now are coming in because of COVID-like symptoms. Very few of them are getting admitted. A lot of them are testing positive, but they're being sent out. But we're seeing this enormous burden of people coming in with symptoms to the emergency room, which is clogging up the medical system and making it really tough for us to take care of people who have the usual gamut of medical problems.
So let's address that right now. Let's just say for those people who are going to the ER with any other issues, what do they do? What do they do instead? Where are you telling them to go? Should they go to urgent care centers instead? Should they go to see their doctors?
Right. So if you have symptoms of COVID, the first thing you should try to do is get a home test, if you can still get one. If you can't get that, reach out to your primary care provider or go to one of our public testing sites. Put a mask on, and don't take that mask off when you're around other people until or unless you have a confirmed negative test result. So you can do a lot of good before going to the emergency room by trying to discern whether you have COVID or not. Next, the emergency room is for people that are really sick. And by that, we mean having shortness of breath, having difficulty breathing, very high fevers, and people with those symptoms who also have underlying health conditions that put them at high risk for a bad outcome. Those people are the ones that need to be in the emergency room. That's who we're there for, and we want to take care of you. But if you're not having those serious symptoms, you're better off getting care from your primary care doctor and also seeking a COVID test in the community.
So what is that threshold when it comes to fevers? At one point, do you say, okay, I'm not going to go to my doctor, I'm going to go to the emergency room? What's the number that we should be looking out for?
Okay, well, typically in medicine, we talk about 101 fever as being a high fever. That could differ depending on the underlying conditions of a person. People who are very elderly, who have underlying immunocompromised situations, a lower grade fever could be more significant for them. But a high fever, a fever that doesn't come down when you take fever lowering medications, and if you are somebody that's vulnerable by virtue of being old or being on immunosuppressive medicines, that's a warning sign that's worth getting checked out for.
Okay, so University Health, we know, is telling people to nix those New Year's parties because of the rise that we're seeing in all of these COVID cases. Yet we know that San Antonio, the city, is still having its huge party for New Year's Eve tomorrow. But you're saying that's okay because it's outside.
Okay, the problem is that if you get cold and you go inside, or you're in a very, very thick crowd and people aren't masked and they're coughing and sneezing around, this could lead to transmission. So if you're outdoors and you're keeping your distance from other people, we know from studying this disease that outdoor transmission of COVID is really rare. The problem that we're worried about is that people will crowd in together at really close quarters and be coughing and sneezing on each other. If you find yourself in a close crowd like that, you better have your mask on. And it should be a really good mask, like a KN95 or an N95 mask, or at the very least, a surgical mask, a plain old face cloth covering, it's just not going to cut it. Why? Because the Omicron variant of SARS-CoV-2 is way more infectious, much more transmissible than the variants we've been dealing with previously. So put your mask on and stay outdoors.
Okay, I'm really glad that you brought that up, because there is a lot of confusion about the impact of the Omicron variant, because we know that the symptoms tend to be less severe. The CDC is now saying, okay, this is the dominant strain that we're seeing right now in the country. So you would think that that would mean fewer hospitalizations, but we're not seeing that right now. Can you explain that?
Right. And that has to do with the sheer numbers of people that are getting infected, including with symptoms on top of being immunized already. So, right, we see symptomatic people that are breakthrough cases, that have people that have been vaccinated. And then you see more serious symptoms in people that were unvaccinated, or people who assumed they were protected because they had a previous COVID-19 infection. When you have huge numbers of people getting infected and getting symptomatic all at once, that is what overwhelms the healthcare system. And a very small percentage are going to be sick enough to need to be admitted to the hospital. But even a small percentage of a very large number is still a large number, which causes pressure on the healthcare system. And don't forget, healthcare workers are also getting infected. So they're getting symptomatic breakthrough cases, and they can't come to work while they have symptomatic Omicron. And so we have a decrease in the number of people available to take care of folks when they're sick.
Okay, one last question that I want to ask you, and we just have about 20 seconds left. Would you advise us to take our temperatures every single day after we have all of these gatherings, and just in case we suspect that we might be sick, or if we do have COVID, do you recommend that we just take our temperatures every single day as a precaution after we meet with our friends and our loved ones?
So that recommendation for checking your temperature twice a day is pretty specific to healthcare professionals, because we need to make sure we identify them right away and get them out of circulation so they're not infecting sick and vulnerable people. I think self-monitoring for non-healthcare professionals is a really good idea. If you're feeling feverish, sure, go ahead and take your temperature. But here's what's even better. If you've had an exposure, or you've been to a party where there's a high likelihood that you were exposed, you need to wear a mask and get yourself tested by about day 3 to 5, and get a home rapid test if you can get it, or a PCR test to make sure that you didn't get infected during that party that you went to. Please stay away from the parties. It's hard to hear this. We all want to celebrate, but it's dangerous right now.
Understood. Dr. Ruth Berggren, an infectious disease specialist with UT Health San Antonio, thank you so much for being with us, and have a very happy new year.
Thanks, and thank you for having me on.
All right, and we'll be right back after the break.